Section 42 of Gray's Anatomy, Part 4. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by David Lawrence. Anatomy of the Human Body, Part 4, by Henry Gray. Sacral and Coccygeal Nerves, Part 2. The common peroneal nerve, Nervus peroneus communis. External popliteal nerve, peroneal nerve. About 1/2 the size of the tibial, is derived from the dorsal branches of the 4th and 5th lumbar and the 1st and 2nd sacral nerves. It descends obliquely along the lateral side of the popliteal fossa to the head of the fibula, close to the medial margin of the biceps femoris muscle. It lies between the tendon of the biceps femoris and lateral head of the gastrocnemius muscle, winds around the neck of the fibula between the peroneus longus and the bone, and divides between the muscle into the superficial and deep peroneal nerves. Previous to its division, it gives off articular and lateral sural cutaneous nerves. The articular branches, rami articulares, are 3 in number. 2 of these accompany the superior and inferior lateral genicular arteries to the knee. The upper one occasionally arises from the trunk of the sciatic nerve. The third, recurrent, articular nerve is given off at the point of division of the common peroneal nerve. It ascends with the anterior recurrent tibial artery through the tibialis anterior to the front of the knee. The lateral sural cutaneous nerve, Nervus cutaneus surae lateralis, lateral cutaneous branch, supplies the skin on the posterior and lateral surfaces of the leg. One branch, the peroneal anastomonic, Nervus communicans fibularis, arises near the head of the fibula, crosses the lateral head of the gastrocnemius to the middle of the leg, and joins with the medial sural cutaneous to form the sural nerve. The peroneal anastomonic is occasionally continued down as a separate branch as far as the heel. The deep peroneal nerve, Nervus peroneus profundus, anterior tibial nerve, begins at the bifurcation of the common peroneal nerve, between the fibula and the upper part of the peroneus longus, passes obliquely forward beneath the extensor digitorum longus to the front of the interosseous membrane, and comes into relation with the anterior tibular artery above the middle of the leg. It then descends with the artery to the front of the ankle joint, where it divides into a lateral and a medial terminal branch. It lies at first at the lateral side of the anterior tibial artery, then in front of it, and again on its lateral side at the ankle joint. In the leg, the deep peroneal nerve supplies muscular branches to the tibialis anterior, extensor digitorum longus, peroneus tertius, and extensor hallucis proprius, and an articular branch to the ankle joint. The lateral terminal branch, external or tarsal branch, passes across the tarsus beneath the extensor digitorum brevis, and having become enlarged like the dorsal interosseous nerve at the wrist, supplies the extensor digitorum brevis. From the enlargement 3 minute interosseous branches are given off, which supply the tarsal joints and the metatarsal phalangeal joints of the 2nd, 3rd, and 4th toes. The first of these sends a filament to the 2nd interosseous dorsalis muscle. The medial terminal branch, internal branch, accompanies the dorsalis pedis artery along the dorsum of the foot, and, at the first interosseous space, divides into 2 dorsal digital nerves, nervi digitalis dorsalis hallucis lateralis et digiti secundi medialis, which supply the adjacent sides of the great and 2nd toes, communicating with the medial dorsal cutaneous branch of the superficial peroneal nerve. Before it divides, it gives off to the first space an interosseous branch, which supplies the metatarsio-phalangeal joint of the great toe and sends a filament to the first interosseous dorsalis muscle. The superficial peroneal nerve, nervus peroneus superficialis, musculocutaneous nerve, supplies the peroné longus and brevis and the skin over the greater part of the dorsum of the foot. It passes forward between the peroné and the extensor digitorum longus, pierces the deep fascia at the lower third of the leg, and divides into a medial and an intermediate dorsal cutaneous nerve. In its course between the muscles, the nerve gives off muscular branches to the peroné longus and brevis, and cutaneous filaments to the integument of the lower part of the leg. The medial dorsal cutaneous nerve, nervus cutaneus dorsalis medialis, internal dorsal cutaneous branch, passes in front of the ankle joint and divides into two dorsal digital branches, one of which supplies the medial side of the great toe, the other the adjacent side of the second and third toes. It also supplies the integument of the medial side of the foot and ankle, and communicates with the saphenous nerve and with the deep peroneal nerve. The intermediate dorsal cutaneous nerve, nervus cutaneus dorsalis intermedius, external dorsal cutaneous branch, the smaller, passes along the lateral part of the dorsum of the foot and divides into the dorsal digital branches, which supply the contiguous sides of the third and fourth, and of the fourth and fifth toes. It also supplies the skin of the lateral side of the foot and ankle, and communicates with the sural nerve. The branches of the superficial peroneal nerve supply the skin of the dorsal surfaces of all the toes except the lateral side of the little toe, and the adjoining sides of the great and second toes, the former being supplied by the lateral dorsal cutaneous nerve from the sural nerve, and the latter by the medial branch of the deep peroneal nerve. Frequently some of the lateral branches of the superficial peroneal are absent, and their places are then taken by branches of the sural nerve. The pudental plexus, plexus pudentus. The pudental plexus is not sharply marked off from the sacral plexus, and, as a consequence, some of the branches which spring from it may arise in conjunction with those of the sacral plexus. It lies on the posterior wall of the pelvis, and is usually formed by branches from the anterior divisions of the second and third sacral nerves, the whole of the anterior divisions of the fourth and fifth sacral nerves, and the coccygeal nerve. It gives off the following branches: perforating cutaneous, second and third sacral; pudental, second, third, and fourth sacral; visceral, third and fourth sacral; muscular, fourth sacral; anococcygeal, fourth and fifth sacral and coccygeal. The perforating cutaneous nerve, nervus cluneum inferior medialis, usually arises from the posterior surface of the second and third sacral nerves. It pierces the lower part of the sacrotuberous ligament, and winding around the inferior border of the gluteus maximus, supplies the skin covering the medial and lower parts of that muscle. The perforating cutaneous nerve may arise from the pudental, or it may be absent. In the latter case its place may be taken by a branch from the posterior femoral cutaneous nerve, or by a branch from the third and fourth, or fourth and fifth sacral nerves. The pudental nerve, nervus pudentus internal pudic nerve, derives its fibers from the ventral branches of the second, third, and fourth sacral nerves. It passes between the piriformis and coccygeal muscles, and leaves the pelvis through the lower part of the greater sciatic foramen. It then crosses the spine of the ischium and re-enters the pelvis through the lesser sciatic foramen. It accompanies the internal pudental vessels upward and forward along the lateral wall of the ichiorectal fossa, being contained in a sheath of the obturator fascia termed Alcock's canal, and divides into two terminal branches, viz., the perineal nerve, and the dorsal nerve of the penis or clitoris. Before its division it gives off the inferior hemorrhoidal nerve. The inferior hemorrhoidal nerve, nervus hemorrhoidalis inferior, occasionally arises directly from the sacral plexus. It crosses the ichiorectal fossa with the inferior hemorrhoidal vessels toward the anal canal and the lower end of the rectum, and is distributed to the sphincter ani externus and to the integument around the anus. Branches of this nerve communicate with the perineal branch of the posterior femoral cutaneous and with the posterior scrotal nerves at the forepart of the perineum. The perineal nerve, nervus perinei, the inferior and larger of the two terminal branches of the pudental, is situated below the internal pudental artery. It accompanies the perineal artery and divides into posterior scrotal or labial and muscular branches. The posterior scrotal or labial branches, nervi scrotales or labiales posteriores, superficial peroneal nerves, are two in number, medial and lateral. They pierce the fascia of the urogenital diaphragm and run forward along the lateral part of the urethral triangle in company with the posterior scrotal branches of the perineal artery. They are distributed to the skin of the scrotum and communicate with the perineal branch of the posterior femoral cutaneous nerve. These nerves supply the labium majus in the female. The muscular branches are distributed to the transversus perinei superficialis, bulbocavernous, ichiocavernosus, and the constrictor urethra. A branch, the nerve to the bulb, given off from the nerve to the bulbocavernosus, pierces this muscle and supplies the corpus cavernosum urethrae, ending in the mucous membrane of the urethra. The dorsal nerve of the penis, nervus dorsalis penis, is the deepest division of the pudential nerve. It accompanies the internal pudental artery along the ramus of the ischium. It then runs forward along the margin of the inferior ramus of the pubis, between the superior and inferior layers of the fascia of the urogenital diaphragm. Piercing the inferior layer, it gives a branch to the corpus cavernosum penis, and passes forward in company with the dorsal artery of the penis, between the layers of the suspensory ligament, onto the dorsum of the penis, and ends on the glans penis. In the female this nerve is very small, and supplies the clitoris, nervus dorsalis clitoridis. The visceral branches arise from the third and fourth, and sometimes from the second sacral nerves, and are distributed to the bladder and rectum, and, in the female, to the vagina. They communicate with the pelvic plexuses of the sympathetic. The muscular branches are derived from the fourth sacral and supply the levator ani, coccygeus, and sphincter ani externus. The branches of the levator ani and coccygeus enter their pelvic surfaces. That to the sphincter ani externus, perineal branch, reaches the ischiorectal fossa by piercing the coccygeus or by passing between it and the levator ani. Cutaneous filaments from this branch supply the skin between the anus and the coccyge. Anococcygeal nerves, nervi anococcygeae. The fifth sacral nerve receives a communicating filament from the fourth, and unites with the coccygeal nerve to form the coccygeal plexus. From this plexus the anococcygeal nerves take origin. They consist of a few fine filaments which pierce the sacrotuberous ligament to supply the skin in the region of the coccyx. Recording by David Lawrence in Brampton, Ontario, December 2009.